So when you're talking of blood pressure, when I see somebody who's extremely obese, say he's like 110 kg, who has a very bad diet, he's always ordering from Swiggy at home, eating junk food,
Correct.
eating lot of salt, fried food. Some people who consume lot of alcohol every day. In these patients, lifestyle modification plays a role, but it cannot replace medicine.
Correct.
So it is said that if your blood pressure is more than 20 millimeters of mercury above the goal, so normal blood pressure is around 120, 130.
Right.
So if your blood pressure says around 160 and the diastolic is 110,
That's quite high.
it's very high. So if you are diagnosed with that level of blood pressure, in fact, all over the world, hypertension guidelines tell you that you immediately start on 2-drug regimen for these patients.
Okay.
So leave alone diet and exercise.
Right.
So what we say as doctor, that I am starting you on medication so that you don't get complications because of this high blood pressure. The complications can be a brain hemorrhage, it can be a heart attack, heart failure, or a kidney failure.
Right.
At the same time, you continue with the lifestyle modification.
Right.
So lifestyle modification is complementary,
Right.
but it cannot replace medication.
Absolutely. Absolutely.
And also remember that some people think that if I stop salt, my blood pressure will go away. No. If you stop salt, what you are likely to get is what a medical condition known as hyponatremia. That means your sodium can go so dangerously low that you could get hospitalized for being unconscious or having persistent vomiting.
Right.
So what we say is salt is important in the diet, but curtailing it. So avoid things that have excessive salts, like having daily pickles,
Correct.
daily papad,
Correct.
daily farsans. So all these things have excessive salt, so cut down on them. But we don't say stop salt.
Right.
So that's a myth that stopping salt will cure my blood pressure. No, it will not cure your blood pressure. In fact, you could have more complications.
Right. So we'll go to the next very important topic of cholesterol, and this is also a buzzing word in common people that मेरा cholesterol high है. So अगर cholesterol high है तो diet थोड़ा सा control कर लूँगा, maybe go to a dietitian, have a properly controlled diet, weight control, and my cholesterol levels will be normal. So this is a common myth. What is the fact? I would like to know from you.
So whenever you see, I see in my practice more commonly patients bringing their cholesterol report rather than me asking for it.
Okay.
So voluntarily, a lot of people think that checking on your cholesterol and then having an advice on cholesterol will be good. So remember that cholesterol is an important risk factor. If you have a high cholesterol, especially we say we have good cholesterol and 2 types of bad cholesterol.
Okay.
Good cholesterol is also called as HDL.
Right.
And the bad cholesterols are like triglyceride and LDL.
Right.
So if you have a certain value of cholesterol, like say if your LDL cholesterol is 200, or if your triglyceride is like 500, 600, 700,
Okay.
if you see these kinds of cholesterol levels, these are called as hereditary cholesterol abnormalities.
Okay.
So these particular patients have genetic abnormalities which they have inherited, and they have very high levels of cholesterol. So when I look at this level of cholesterol in any patient who has like LDL of 200 and who has triglyceride of 500, he is a patient who will need treatment for life.
Okay. Correct.
So besides lifestyle modification, he will need treatment for life. There's another group of patients who, whether they have high cholesterol or normal cholesterol, will need medication for cholesterol.
Right.
That is a patient who's got heart attack,
Correct.
a patient who's got undergone angioplasty,
Right.
a patient who has undergone bypass surgery, or a patient who's diabetic, who's more than 40 years of age.
Right.
We give them cholesterol lowering medications so that they don't get all these events.
Right.
But suppose if it's a young boy who's like 25, 30 years old, who's been working from home, eating at home, not moving, and eating a lot of junk food. Now when I say junk food,
Yeah.
say if you eat say vada pav bought from a vendor outside and you make vada pav at home,
Okay.
there's a tremendous difference, Supriya, in that.
Oh.
Why? Because the vada pav fellow will keep on reusing that oil.
Yeah.
When you
Correct.
reuse oil, the oil gets converted into what is known as trans fat. These are 10 times dangerous.
Oh my God.
So why we say avoid junk food,
Yeah.
eat home food is for that reason. Is you are consuming a lot of trans fat.
Correct.
That has a direct correlation with increasing fat in each organ. So your
Right.
blockages, your fatty liver disease, fatty pancreas, and abdominal obesity, all is contributed by this trans fat.
Oh, it just amplifies the existing
Absolutely,
problem.
it is 10 times atherogenic, is what we say. So that's where the role of junk food and the diet comes.
Right.
At the same time, there are people who think that if they would turn totally vegetarian, their cholesterol will go away. No. If you have a genetic problem, you will still need medication
Medications. Correct.
for cholesterol if you have these dangerous level of
Right.
cholesterol.
Right.
At the same time, I would also like to highlight a point that in heart disease and in overall lifestyle disease, more than cholesterol, it's the sugar.
Okay.
It's the amount of sugar that you consume is more important than the amount of cholesterol that you have in your diet. If you understand simple science and physiology, what physiology says that what cholesterol you have in your blood, 70% is contributed by liver.
Okay. Right.
So the liver converts whatever calories you consume into cholesterol. Only 30% is dietary. So as a doctor, I am not very hard on my patients.
Right.
I try to educate them that you take good green leafy vegetable, multiple fruits, you can have lean meats, you can have white meats, fresh fish and egg whites in your diet.
Correct.
These are all healthy foods. Avoid eating processed food and junk food. That would be my mantra
Advice.
for cholesterol.
I think you are giving little leniency to your patients because you understand that's a scientific way of explaining them and giving them little freedom on what they can eat. I think good concept you brought about is familial cholesterol levels being high, and then the cholesterol which is related to other maybe diabetes or hypertension. Right. So we'll go to the next myth, which is about water intake. So again, this is a very common myth that पानी पीना सेहत के लिए अच्छा होता है, and if you drink more and more plenty of water, it's good for heart and kidneys. So what's the fact around this?
So Supriya, I have my patients who come and tell me, ma'am, as soon as I get up, I drink 1 liter of warm milk, warm water,
And I think that's very common.
and then I put some lemon in it and I put honey in it. Almost 1 liter I drink on empty stomach. What I say is that when you drink water, your body should have the capability of excreting that water.
Right.
So around 2 liters is okay for most of the people. As we say, 8 glasses of water is
Okay.
good.
Yeah.
But there are certain conditions,
Correct.
especially if you have a heart condition in which your heart pumping is weak. So common people say my ejection fraction
Okay.
or the pumping power of my heart is low.
Right.
So if your ejection fraction is low, your heart is weak, or if your kidney is not working properly, your creatinine is high, these are the patients who should not do this,
Right.
because their ability to handle water is gone abnormal because of their heart and kidney conditions.
Right.
In fact, there are times when you have both the diseases coming together. Say a diabetic patient whose heart and kidney both are
Or
affected.
compromised. Yes.
So at that point of time, as a cardiologist, I tell my patients that if your heart is weak, your fluid restriction is around 1.5 liters. At times we make it 1 liter.
Okay.
And patients who are having failing kidneys, in fact the nephrologists are very strict on their
Water
amount of
yeah.
water they take.
True.
Because it has direct correlation with how much urine are you making.
Right.
So if your body is not able to handle this water, you should not do this. So I would say drinking water, 8 glasses of water is good. In a hot weather it's good. But if you have heart and kidney conditions, please listen to your doctor's advice and follow their advice. Don't listen to your friends.
Thank you, Dr. Zakia.